this platform. Okay. The name of our guest speaker is Dr. Oluseun Peter Ogunnubi. He's a seasoned researcher and a clinical clinician. He is a senior lecturer at the Department of Psychiatry, University of Lagos, Nigeria, the CEO, consultant psychiatrist at TM Grace Cottage Emotional Wellness Clinic Limited, a private mental health facility located at Ilupeju, Lagos. Dr. Gunubi holds a medical degree in medicine and surgery from Olabisi Onabanjo University, Ogun State, as well as a postgraduate medical fellowship in psychiatry. He also holds a certificate of leadership and management in health from University of Washington, a master's degree in public health and Central University of Nicaragua, UCN, and another master's degree in population health at the University of Saskatchewan, Canada. I hope I pronounced that well. Dr. Agnebi is a World Health Organization certified mental health advocate. He's deeply committed to humanitarian works. This he does mostly through the real one. So, Dr. Agnebi, out of your numerous and enormous um, certification and service to humanity, I because of our time, I give this brief introduction to this day.
Thank you.
Thank you for coming, and we appreciate your presence.
Thank you.
All right, so together we are creating more awareness and talking about the global mental health day, which we are celebrating today, 10th of October 2014. And to start with, I want us to talk about what is mental health and what is mental health in the workplace.
Yeah. Thank you so much for having me. It's another day to celebrate the World Mental Day. Every year, all over the world, people mark this day to raise awareness and to talk more. And the reason why it is so is because, mental illness is not well known. Mental illness, people know more about physical conditions. We really don't know much about emotional, psychological issues. And that's why I love the question you first asked, what is mental health? And then we talk about how is it related to the workplace. Mental health is, because I'm going to be speaking in layman's term, I'm not talking to my colleagues, psychiatrists or medical doctors or psychiatric nurses or psychologists. I'm talking to that man on the street. If I want to explain what mental health is all about. Mental health is all about our mind. When we have sound mind, and who do we say have sound mind? Someone that can contribute meaningfully to his environment in terms of sleeping, in terms of thinking, in terms of mood, in terms of both spiritual, psychological, everything is sound. Then you say that has mental wellness. You are not troubled by anything. You are not anxious state. You are not downcasted. You are not panicking. Everything about you is sound. Then you say that person has mental wellness. If any of this is now missing, then you say person has emotional disorder. If it now results sickness, like severe depression or anxiety or then you say the person has mental illness. So it's a spectrum. You have mental wellness, then you have emotional disorders. Maybe I'm not able to sleep alone, but it's not that I'm saying rubbish. It's not that I'm down. I can still work and do things, but I feel when you lock the door, I feel when you open the door, you shut the door, I feel somehow. Then I know that my mind is not stable. I'm not really happy. Then that is emotional disorder. But when it has now led to I'm not happy, I can't contribute, I'm always staying indoor, I'm hearing voices, then you say it's mental illness. So most people fall in the realm of mental disorders. Why, if you don't take care of yourself, it can now become mental illness. And that is why World Federation of Mental Health has come out to say, don't let us move from mental wellness or mental health to mental disorder or emotional disorder and mental illness. Let us stop
Mm,
it. And they now identified that workplace is one of the breeders or silent breeders of emotional problem.
mm,
Mental illness is not just what we see in some of the movies where you will sleep and then somebody will just spread something and then you start behaving abnormally. No. Stress, discrimination, stigma, many things, poor remuneration, workplace hazard, risk. Those are the things. Exposure to risk, harassment, poor working condition, poor pay. All those things are things that you imagine someone going to work. The environment is risky. He has to travel long distance to get there. The boss is always harassing him or her. There is no good pay, no benefit at the end of the day. He's always thinking. But he has to go because at least it provides food for the family. Such a person will be going every day but not happy. That is why WHO looked at it that we should identify workplace. They say it's time to talk about workplace because 60% of the global population are employed in either government, private, or other organizations. 60%. And if it is 60% of the world population that are employed, then we should ensure that we look at that risk area. So this year, what we are doing is that we are looking at a particular risky population, which is those who are working, the working class, who make up 60% of the world population. And then we are saying, let us talk about the emotional wellness associated between work and mental health. Thank you.
thank you very much, Dr. Ogunnubi. Now, you said something about we are not talking to um, just anybody, we're talking to all the population.
Everybody.
And by the way, that is why today, even though I'm a mental health nurse, I am not representing my knowledge in mental health. I am representing the voice of the people. I am projecting what they ask me or what people often say or what they don't know about mental health. And I love that fact. Now, we are saying that we have defined what mental health is and what mental health is in the workplace. Now, what does a mentally healthy workplace mean? What will they have? What will they portray? What will they give their employees? Can you please take us on that?
Thank you very much. I know that it may be like, oh, when I finish talking now, they will say, our Dr. Ogunnubi, this one is a mirage. You can't see such a workplace. But see, I love the question. Okay, if we cannot get that, because I'm going to be describing, and I'm not speaking out of euphoria. I'm not speaking like, look at this doctor. Where are you going to see that one? No, it is the desirous thing that we create this environment. So now, an ideal work environment is an environment where I, as a worker, we want to go. It's a work environment that is like home away from home, where there is no stigma. If I'm going through emotional illness, I'm not being stigmatized. My promotion is not delayed. My colleagues don't backbite or speak against me. A healthy emotional wellness environment or workplace is that is devoid of discrimination. Is that is not exposed to risk. Both occupational hazard in terms of physical or emotional are already taken care of. A sound or emotional wellness work environment is that is devoid of harassment, whether sexual harassment, financial harassment, bullying, all those types of harassment in the workplace. There is nothing like that. And if you are harassed, your right is protected either by the organizational policy or by a union. A sound emotional wellness environment or workplace is that the remuneration is beautiful. Is that each time I get my wages and salary or salaries, I am happy. I feel on top of the world. It is that my salary can take me home. I will pay my children's school fees, pay my rent, and I will still have so much more in my pockets. A sound wellness or occupational environment is that the environment is beautiful. The good office space, meals, the breastfeeding mothers can bring their children to work and take them to crèche because they have provision for the mothers who are breastfeeding or the nursing mothers. Is that they have gymnasium or places that they can use do exercise, place where they are served lunch, where they are giving vacations and breaks, where there are opportunities for seminars, for people to come around and discuss issues, where the HR is approachable, not the one that you are afraid of human resources department because they are like lions who want to kill you, who want to make sure you lose your job, where you are free to talk to HR head or anybody in HR department. A good wellness occupational environment is that is devoid of intimidation, where people will envy you and say, wow, I want to work in your place. How can I get there? This is not a mirage. This is achievable. And that is what WHO and World Federation of Mental Health is saying, that we must create that environment. I know someone is saying, wow, it really sounds like heaven, but we can create it. As an employer of labor, government, organizations, we can create that environment. And that is what WHO is saying. Wake up. Let it become conscious. Let us be conscious about these things. Let us understand that this is what we need to do. Let us be intentional about it. Let us be deliberate about it. Let us create it. Let us strive. Let us aim that this is our mark. And every time, quarterly, let us mark ourselves. Organizations should score themselves based on some of these things that I've mentioned. And when we do this, I'm telling you, mental illness or emotional disorders will be far away from an average worker. Thank you.
Oh, okay. To be honest, all you've said in my country, Nigeria, and many of the workplace that I work or that I know people work in, on the scale of the 0 to 10, with all you have said, what will you scale many organizations? At what point do you think many organizations are in creating this healthy, mentally healthy environment for their staffs or their employees? Realistically speaking.
Well, to be sincere, it's a sad scenario in developing nations. It is far better, for example, I'm in Canada here, and I can tell you, I'm at work now. I have an hour break, and that's why I can do this. We have informations at our disposal. We can do things. To be sincere, honestly, what is the difference between developed nation and developing nations? There's nothing. The same human being. As a matter of fact, do you know that developing nations have more resources? These people don't even have as much resources as what we do back in developing nations. But they have been able to organize themselves in such a way that these basic things are provided. It is not a brainer that you give good incentives. It is no brainer that you make sure that there is a strong policy against stigma, against discrimination. It is no brainer that you don't expose your workers to. For example, I was working in a particular day, and one of the clients I was working with verbally abused me. I did not say anything because I felt it was normal. By second day, I received a call from workplace insurance. And guess what? They said, oh, we had a verbal harassment against you. It was reported by another staff member. I want you to know that resources are available for you. Should you need counseling, should you need to stay off work for 1 week or two, everything will be taken care of.
Really?
I said, normal abuse that we are using to rob our body in developing.
Really?
I was surprised. They sent me several links. They say, are you sure? I say, I'm okay. I say, are you sure? I say, wow. So what am I saying? It is not heavenly. All these things I've mentioned. An emotionally safe work environment is possible. Even in developing nations, they are still trying to get there. But realistically, in developing nation, maybe we are at 10%. While in developed nation, they've got it to 50%. They have their problems. And even you can imagine with those organizations and everything I've mentioned, they are still talking about it today because WHO is talking, the World Federation of Mental Health is talking, and they are not talking about developing nations alone. They are also addressing developed nations, the Western world. So it is just the way it is practiced. But I can tell you, we can move from 10 to 90. They can move from 50 to 90 or 100, but it is achievable if we are conscious and intentional about it.
All right. Thank you very much. And that is a high opener for many people who run businesses, have organizations, that these things are achievable if only we are intentional about it. Okay, let's talk about the challenges and stressors at work and how to handle them. I'm sure you're a psychiatrist for many years. In fact, I was talking to a senior colleague of mine who said, I know Nubi, Piroro, Piroro. So now I know you've come across different patients in different fields of discipline, right? Now, doctors like yourself, nurses, accountants, and all. What are the specific or are there specific mental illness that is associated to workplace and how the stressors or the triggers can be managed?
Well, thank you. The questions are lovely, and I just love these questions because these are relatable questions. These are not theoretical questions. These are questions that can, anybody on the street will ask. The truth is this. Stress is a precursor. Stress is a foundation of emotional problem.
Okay.
If that man on the street can understand this, my day is made. Stress is a precursor or is a foundation for emotional illness. Therefore, if you remove stressors, you have removed tendencies or the risk of emotional illness. Therefore, if I look at anything in the workplace that is giving me stress, if I can take care of it, I've done a lot. So if a nursing mother is well accommodated and taken care of in any workplace, the burden of trying to cope with childbearing, nursing the children, also filling his duties or our duty in the place of work will not be a problem. So when we say stressors are precursors or foundation, that means if you allow stress in the workplace to continue, it will lead to burnout. And when there's burnout, it can open, it's like a warehouse to any form of emotional problem. It can be anxiety, it can be depression, it can be psychosis, it can be addiction, it can be panic disorder, it can be somatization. There is no particular illness that is associated with emotional illness. The truth is that workplace stress can lead to any form of emotional problem. Workplace stressors can cause any form of mental illness. If the person is now susceptible, for example, if somebody is susceptible to having psychosis, if there are stressors, which we call stress diathesis theory, that is, already now, if, for example, I'm at high risk of developing depression, if everything about my life is okay, no workplace stressors, nothing, I will live 150 years, no depression will come up. But don't forget, I'm already at high risk. But should I now work in a place where they have stigma, discrimination, risk, poor working conditions, and everything? That depression that's supposed to stay forever without manifesting itself will now come out. And what will now happen? I will now come up with depression. Ditto for someone that has tendency for anxiety, tendency for panic, tendency for psychosis, and even addiction. Addiction is one of the main or commonest challenges that we have. Some people, when the stress becomes so much, in an attempt to overcome stress, they now cope in a maladaptive way by using, you tell people, oh, my work is stressful, and they take medication, tramadol, codeine, cannabis, loud. These are problems that we have. So why people take it in an attempt to reduce their stress and everything, they eventually become addicted. And that is why you see workplace stressors and substance abuse, they are 5 and 6. And that's why we're saying organizations should remove stressors so that people don't need to use some of these substances. And if you're overstressed or you're excessively stressed, you don't need to use substance because it will lead to addiction and it will be a vicious circle. Thank you.
Thank you very much, sir. So that means that all sorts of mental disorders can be triggered
Yes.
with workplace stress.
Yes.
And most often, because you want to beat the task ahead or the what is expected of you, then people tend to take substances just to perform higher. Then it leads to addiction and dependence as much as possible.
Yes.
Very well. That is taken. And now we have 22 participants. I'll just call names at random to know that we acknowledge your presence and we appreciate your time too. Joseph, thank you for coming. Kemi Tuta, we thank you. Shade, Uche Greg, Vadila, Ahmed, Funke Bayojo, thank you for making time to join us today. And I hope that you're going to find value for your time being spent with us. Okay, moving on. Dr. Nubi, can we talk about work-life balance? How do we do this balance? We got to work because we need to earn money and live the life, right? Then we have family. Then we have academics on the side. Of course, you don't want to stay in a sport and then you need to climb the ladder, right? So how do we balance all these things without breaking down, without have mental breakdown, emotional breakdown? How do we do this?
Yeah, I thank you so much again. It's important for people to know that, and this is a very critical area you are mentioning. In fact, the lecture on maintaining work-life balance is like a 4 hours lecture, which if we start, we'll not even finish. But I will give an example because people are asking, someone may be asking, what is the meaning of work-life balance? It simply means you are taking your work to your house and you are bringing the house to work. There is chaos. So you're at work, you are thinking of children's school fees, your husband problem, your wife's problem, the landlord's issue. You are not concentrating, you are not giving your employers the maximum performance. Or you carry the work and you take it home. And at home, instead of you to have time for your partner, have time for your children, relax, sleep well, you are still busy on your laptop. No time for the children. ASEP is the one teaching them. What have you done? You have carried work to house and you have brought house to work. And we are saying, let each one remain there. Problems of the house should remain in the house. Problem of work should remain at work. So your inability to maintain this is what we call inability to balance your work and your life. Your life is your personal life, your relationship, your social connections, your free time, exercise, feeding, your children, partners. Those are your life, things about you. Your work is what gives you money to be able to take care of your needs. And your ability to maintain is. But you see some employers, they will call their staff 11 p.m. at night. Some employers will call their staff 1 a.m. Some employers will fix meeting for Sunday afternoon. Some employers will harass their staff that, oh, I saw your DP, you went to a party, so you have time to party. Some employers will harass their staff on Monday. Oh, no wonder you are not able to meet your marketing targets because you are busy partying, because they saw the status. When you do this as an employer, you are not helping your staff to maintain work-life balance. And that's why I tell every employee, except you desire it, except you want to, no employer should harass you when you are not at work. So it is important because inability to maintain work-life balance creates chaos. We add to your stress. And don't forget, when we have chaos, when we have stressors and everything, what do we have? We create warehouse for all sorts of emotional illness to come up. Thank you.
All right. Thank you very much, sir. Now, to my fellow women outside and to the men too, they said work is work, house is house. Don't bring work to the house and let house remain house. So that is what we just mean by balancing it. And take time out from, possibly I'm just highlighting his point. Possibly you're just joining or you didn't meet us, where take yourself out. Know that this is important and that is important. And let's, treat them at once. Now, can we talk about some things happen to the workplace post-COVID? Post-COVID rearrangement of workplace. Before now, some organizations do not know that they can actually run without people not being physically present in the office. Now, when you go to the office, you see somebody, you talk, you chat. Somebody see that your face is gloomy or is bright or something, comment on your dress. But now, working remotely looks like the order of the day. In fact, everybody wants to change job to tech job so that they don't do 9 to 5 anymore. So how is that affecting mental health, or how is that going to affect mental health, futuristically speaking?
Well,
Sir, did you get my question?
how is that affecting mental health now?
Now, and how is it going to affect it futuristically speaking? Because many people are quitting their 9 to 5 job to do tech because they can actually work from the comfort of their house. So, what do we have to say about this lifestyle of, new working lifestyle?
Yeah, well, there's nothing we can do other than to adjust. Of course, the work craves to see physical connections. The work craves to see people coming together, talking this and that. But now, do you know what we call it? We call it the new normal. It has become a normal thing. If there is anybody listening and is still thinking of, oh, those days where we used to be in the office, this and that, you need to just wake up. And that's why we said adaptability. Do you know before when we were in science class in secondary school, they taught us Mr. Niger D.
Yes.
We say, oh, movement, respiration, nutrition, irritability, growth. So all those things. Do you know now they've added A to it? So it's now Mr. Niger DA. The A is adaptability. One of the characteristics of living thing is ability to adapt to its environment. If you continue to complain and complain and complain, the truth is that we're in the new normal. And that is why you are expected to adapt. And that is one of the characteristics of human being or living thing. So we need to adapt. It's a new normal. You need to understand that even though you are at home, you must have the mind that you are in the office. So you don't work endlessly. The tendency of working at home is that you will not even know when you should take a break. You work continuously without giving yourself a break. You get distracted. You don't pay attention to your children, to your spouse, to people around you. And that can create chaos. You'll not be able to maintain work-life balance. So it's all about understanding. If you're at home, you resume 8 o'clock or 9 o'clock, be at your desk, take a break by 12 noon, by 11, come back, start your work, and when it is 4 after 8 hours, end for the day. Close your laptop. Know that imagine that you have finished work for the day and you're coming back home, even though you are at home. So, in as much as it is a blessing, it can also be a curse. You may say, oh, thank God I'm not going out and cook. But you may actually be overshooting the time that you're supposed to work, and you'll be eating out of the time you're supposed to rest. Thank you.
Thank you very much, sir. Moving on, can we talk about conflict resolution in the workplace? Rivalry, you know, all those things that, there's a way you just come into the work and you will see people talking about you earlier in our discussion, our conversation. You have talked about delayed promotion, remuneration, adequate remuneration, good place work and all of that. But now, there is a saying that where two, as far as you are human and you're two or three, definitely we have preferences, we have dislikes and all of that, and there is bound that we disagree on many things or some things.
Yeah.
So as workers in the workplace, to promote or further promote our mental health, how do we adequately resolve conflicts in the workplace?
Well, I believe that every organization should have, in fact, as a matter of policy, every organization should have conflict resolution policy. Conflict resolution policy. Every organization should have it. It is so important. The way company A will resolve conflicts is different from the way company B will resolve it. In most interviews now, the issue of conflict resolution comes up. Hardly will you go for any interview and they will not ask you. Suppose you have issue with your other colleague, how do you resolve it? And there are many options. Some organizations prefer you walk up to the person and explain in a polite terms what you're not comfortable with. Some organizations believe that if you want to avoid confrontation, go straight to the next manager in line. If it cannot be solved, you escalate it till it gets to the top management. Different companies have different policy for conflict. And that is what we are saying now. It is not for employees to be thinking of how to resolve conflict. It is for the organization to set in motion conflict resolution so that people will know that if I'm grieving, I can grieve certain things and it will be resolved. When we say we grieve, it doesn't mean we've lost something, but we're saying we're not happy about something. So I can grieve it that I have been offended. My right has been infringed upon. My personality has been tarnished. And I should feel comfortable. I should feel happy. I should feel confident in my place of work that they're able to resolve such issue. And that is a lesson for job providers, for employers of labor, government, and co. And that's why I think sometimes ago in Nigeria, for example, there's what we call Savicom. Savicom was,
Yes.
inaugurated so that both clients, customers, and providers can, so there are Savicom offices in most of the federal government parastatals or agencies where you walk and say, oh, I've not received good service for this thing. That is conflict. And you can go and solve it. There are different dispute offices, PRO offices where you can go to. And so also, we must create that opportunity for employees to to hear their grievances, and it will help a long way. Because If conflict is allowed to breed in a workplace, it will not allow teamwork. Conflict destroys teamwork. And of course, you know what team is? Together, everyone achieves more. And that is the acronym for team. And if that area is broken, everybody will be working in silos. And the organization will never be able to meet its objectives. Thank you.
Okay. Thank you very much, sir. Moving on. And our audience, I still say thank you very much. I can see we are having the figure. I keep eyeing up, and don't forget to send in your message, your questions, so that we can look to it and we can have a great time together. Moving on, sir. What we talk about? How employable are the mentally disorder in the marketplace? And how do we deal with stigmatization? I want us to wrap it up so that, because I know you have an hour break and I want people to have questions and then we can do, but this, we can talk about mental health without talking about the stigma that comes with it. Like I used to tell my patients, they're not the only one that get the stigma. I get it too as a mental
Mm.
health nurse, among others. They just feel like you're acting like your patient. So how do how employable, what's the employability rate of the mentally disorder in our society, and how do we avoid the stigmatization or help them through their mental health recovery journey
Yeah.
in the workplace?
Well, thank you very much for that question. In Africa, in developing nations, there are mental health acts that have been passed, and it protects the rights of those with mental disorders. The truth is, organizations cannot do what they like any longer. It's no longer the same. For example, in Nigeria, in Ghana, South Africa, you cannot discriminate people based on the fact that you got the hint that they have mental or emotional disorders. You cannot. You can be sued as a company. As an organization, you can be sued. So I have had a situation where a proprietress got hold that one of our teachers was my client. This person has been stable for more than 3, 4, 5 years. Guess what? The day she got hold of it and confirmed, she first asked her to come and get a letter of fitness from the hospital. We graciously granted her. The next moment, we heard from the lady that she has been sacked. No symptom display, nothing. This person has been stable for 5 years, coming for his regular checkup. If that person tries it now, that my patient will be in billions of money because it's an opportunity to sue. No longer. The mental health act protects the providers, protects the clients. There should, as long as you are deemed fit. So most of the time when people come to my organization and we admit them at Grace Cottage Clinic, when they are leaving, they say, oh, don't let it. I say, don't worry, go to work. Nobody will stigmatize you. If they stigmatize you, they have made you millionaires. They say, oh, please just help us write that there's a breakdown, fatigue. I say, we'll write emotional breakdown. Let us see that person that will stigmatize you. Because as long as we have deemed you fit to go to work, you cannot be stigmatized. So we are going to get there. I'm happy that the law protects now. If you were talking to me 5 years ago, 3 years ago, maybe we will not be able to say this. But Nigeria has passed the Mental Health Act, for example. And all over the world, we have Mental Health Act, we have Trade Union Act, we have several acts that protect the rights of those with emotional illness. Because if you don't protect their rights, the stigma, harassment, and everything will further increase the burden that these ones are having. It will worsen their emotional illness. It will lead to suicide and many other things. We don't want this to happen. The fact that you have mental illness does not mean you cannot contribute meaningfully. If you are taking medication, you are going for your follow-up, you can contribute adequately. So nobody should be discriminated based on their level of emotional illness or the presence of mental illness. And we thank God that, the legislation is now there, especially for those in developing nations.
Thank you very much. Thank you very much. Now, let's talk about this. Let's talk about how environment, I mean, as employer of labors and as colleagues, how can we create that supportive environment for each other in the workplace? What should we care about? What should we do for each other that can create, because all we have been talking now has been landing on employers, employers. But employers are not the one that fill the workplace. We are the one that fill the workplace. And most of the bad mouth, derogatory words, some of them are from your colleagues. So how do we, as human,
So, Mrs.
create a
Thank you so much.
supportive environment? Yeah.
Honestly, you are right. Honestly, you are right. And that's why I said when we talk of workplace, we have stakeholders, government, workers, organizations. Those are the three. Even we workers, we are part of the problem, and we also be part of the solution. The truth is that empathy is what I preach. I preach. See, Titi, the truth is this. When people have empathy, it will help you to know that this condition I can also be. Do you think people came from, they came into existence with mental illness, and some are so destined not to have mental illness? Nobody chose that, oh, my destiny on earth is I'm going to have mental illness or emotional disorder.
True.
Environment, stressors, challenges of life, trauma. These are things that can predispose to mental illness or emotional disorders. So empathy comes when you empathize. You put that person in your shoe, or you put yourself in that person's shoe, and you'll be able to say, oh, with empathy and compassion, you will not use derogatory comments, you will not stigmatize, you will not harass. You will be able to take this person as your own. So the method home is connect before you condemn. Connect, empathy. Empathy goes a long way. Let us preach empathy. The world lacks empathy. Empathy is different from sympathy. Sympathy is when you just say, oh, what a pity. But empathy is you putting yourself in the shoes of that person. These people never desired to have this problem in the first place. And mental illness or emotional disorders is no respecter. They are no respecters of anybody. It's not a respecter of status, stature, state of origin, country of origin, tribe, ethnicity, whatsoever. Affluence, poor. It does not matter. Anybody can fall ill. Anybody can be ill. It does not matter. So when you have this mindset, it will help you to know that I need to tread cautiously. I need to tread with caution. I need to be able to say, oh, these are the things that I will feel if the table was to be turned around. So with this empathy, it will help to be able to, manage those with emotional problem in the workplace. And that is why it's so critical. Empathy is so critical. And that is what I preach. I say, have empathy. If you are empathetic towards the other person, we will reduce discrimination, stereotype, or stigma. And people that have emotional illness or mental disorder, they will feel safe around us. They will feel safe to disclose their problems. They feel safe. People with emotional disorders are afraid of going to the HR because the moment the HR gets to know, they will say, oh, they begin to watch, micromanage, and begin to do periscopic view of your work. At the next moment, oh, you are performing below average. Situations that the things they would not have said or the step they would not have taken if they did not know you are suffering from emotional illness. But because they know now, they will now be going, oh, it's because of the emotional illness. Oh, it's because of the mental illness. Let us ask him to go home. There's a case I'm working on now. This person was given premature retirement, early retirement, because they felt and they assumed he will not be able to work because he was depressed. Instead, rather than send him for employee assistance program help, they decided that let us give him early retirement, and they gave him several package and everything. I said, no. I asked, is this what you want? Said, no. Then we're going to manage you. After treating you of the depression, we're going to take the case off. I am an advocate. Advocate for those who have emotional illness, both in the workplace, anywhere. And when people come to our place, we do not only take care of them alone, we make sure we look at their holistic life and we take care of that. I would have just stood and said, okay, let me take care of severe depression, give you antidepressants, and you'll be okay. No, I asked a specific question. Are you happy to have been given early retirement with several packages? He said, no, I love my work. I said, then you go back to that work. And we've gotten a lawyer and we're working on it. So
wow,
are the things that we should do as advocates. Organizations should come up and advocate for those who are going through emotional. This question you asked me is a triggering question for me because people that are having emotional illness, they are having what we call double jeopardy. Jeopardy one is that they have the illness you and I don't have. Jeopardy two is that they are being punished. You will not punish anybody for having surgical condition. You will not punish anybody for having malaria, typhoid, myocardial infarction, diabetes, hypertension. But when people have depression, anxiety, addiction, and you punish them. This should stop. This should not happen. Human Resources Department must learn. They must send their members. Organizations should learn to identify signs and symptoms of emotional illness and the right way, so that you do signposting. When they are okay, they will come back without stigma or discrimination. Enough of us trying to give them double jeopardy. NGOs must rise up. All over the world, we must support people with emotional illness because nobody desire to be ill. Nobody desire not to be able to contribute their quota. We must stop double jeopardy. We must stop stigmatization, stereotype, and other forms of discriminations in the workplace. Thank you.
I must say that I think I really, I don't know, there is a part of you that I really, just turn on with this question. The energy was, increased, and I can see the passion popping into every word that you said about that. And I said that, like I said in the beginning of this um, 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 talk, I said that I'm not coming as a nurse. I'm not coming as somebody that has this knowledge. I'm putting myself in the position of the people I've seen, I've met, I've cared for, I've spoken with, and I've loved and I've cared for, as family, as friends, as patients, as a neighbor. And these are things that I know that happen. And that is why I accepted when the CEO, Dr. Akeride of Sound Alliance Foundation, and you approached me, of which I'm a great member of the NGO, and wanted me to moderate for this section. Naturally, I actually wanted to have my own section for today, but I said people will not ask the real question because of this still stigmatization. They don't want to know that they are going through it, and just because of the way we to talk about it. And that is why I said I'm going to be the voice of my patients today, letting the world know that we, the workplace, that we constitute the workplace, and we can help them so greatly. And I thank you for that insight. I can feel the genuineness, I can feel the passion in every word that you said. And God bless you, sir. What final words? I'm looking at the time, I'm very conscious about it.
Thank you so much.
And what final words do you have for us as we go? We go back into our work. I want people to have a different orientation, different thinking, the way they handle people and relationship back in the workplace. What do you have for us as we go?
Thank you very much. It's been a robust opportunity. Sound Alliance Foundation partnering with me and my organization, Revisionaries Initiative, to do this. And don't let us be deceived by the numbers watching now or numbers present. This program is being recorded and it will be played on different platforms for thousands and other viewers to see. It's going to stand the test of time, and I'm happy we are doing this. I'm very sure it will be posted on Instagram, Facebook, YouTube. We are also going to repost it, and those who are not able or opportunity to be present will listen over and over. My final words are many, but I will just summarize. One, mental health is a silent breather. Workplace environment is, silent breather of mental illness. And once we understand and identify that workplace can breed mental illness through stress and other things, it is important that organizations, employers of labor deliberately, intentionally, and consciously do something to prevent emotional disorders by reducing stress. We've also discussed here that empathy will go a long way. When we empathize with our colleagues who have emotional illness, who are co-workers with us, we are helping to reduce their symptoms. We are reducing the emotional burden, and we are not adding more to their challenges. It's also important for us that stakeholders, governments, NGOs, private organizations, manufacturers, owners and captains of industries make deliberate efforts to create enabling environments where there will be no stigma, risk, no harassment, good opportunities for workers to thrive. It's also important for us to know that it's okay not to be okay. Having emotional illness is not a death sentence. Whether you have anxiety, depression, manic disorder, bipolar, addiction, and co, you are still a human being and you deserve every right to be treated well. And on the final note, I want to say that as we celebrate the World Mental Health Day 2024, let us know that Employee Assistance Program is the order of the day now. Organizations that care for their staff and also care to get the best from their staff and workers should enlist them in EAP. Employee Assistance Program is like HMO. But what we do is that organizations focus more on HMO, who takes care of physical conditions alone, hypertension and the likes. But good organizations who are thinking, who understands and who wants to get the best out of their employees are now enlisting them on EAP. We as Grace Cottage Clinic, for example, we have EAP structure where we serve different organizations, and with agreement with those organizational bodies, their members can call us. Confidentiality is taken care of. HR does not need to know anything about their problems, and they are doing very well. So the way they will go to HMO will refer them to hospitals. So also they call, oh, I'm suicidal. Oh, I'm depressed. Oh, I have problem of addiction. I don't want to lose my job. And we take care of them. We only send reports about the number of people we see, and that is all. And with that, the organizations are able to take care of the physical and the emotional aspects of their workers. These are smart organizations. These organizations that know that being present alone, presentism, does not make an employee to be able to put in the best. It is when you take care of the physical and psychological aspects of that particular employee. So I'm admonishing, I'm advising that as we celebrate this World Mental Health Day, we should be conscious and we should know that workplace is a silent breeder of mental illness, and we must not allow mental illness to thrive. And to do this, we must provide an enabling mental wellness environment. Thank you.
Thank you very much, sir. So now I'm seeing some questions popping up. I've been looking at the chat since I did not see many people talking about it. So I can see one is saying it wasn't approved. I resigned 3 times and my boss then didn't approve. I had to stop going to work and switch off my phone. Now I understand why employees assistance program and co, which does not necessarily have to be in form of financial. It could be rendering emotional assistance and all. at least being able to speak with someone. Very good, and that is very good, very good. At this point, Dr. Ekarinde, which is the CEO of South Alliance Foundation, I think you have some of the questions that I don't know why I can't access them right now. Please, if you have them, can we read so that we can address it and you can give the vote of thanks? Please, you've got the floor.
Maybe just one or two questions, and then other questions can be submitted on YouTube, and we will definitely answer
Yes.
all of them.
Amazing. Yes, Dr. Karinde, please.
Okay, so thank you very much. So much has been said today. Thank you very much, Dr. Ogunnubi, my very respected chief. I understand that break time is almost over, so we may not be able to take any other questions. So apologies for that also. And that being said, special thanks to our chief all the way from Vancouver, Canada. He's very, very busy, but when it comes to mental health issue, you can see he's always very, very passionate about it. And you can see all the amount of information he has dished out today. We really want to appreciate you, sir, for your time. If we are to pay him, like he said, this probably will cost millions, but he has done this for us to educate everyone free of charge. I just must say that Dr. Peter Ogunnubi, a world-class psychiatrist, mental health advocate. Now I saw public health mental health physician. Thank you so much for your time. And also to our moderator, Nostiti, another public health mental nurse. You can see if we have 10 hours on this event, we are going to keep talking about mental health because both speakers and both the speaker and the moderator are both passionate about mental health, and you can see based on the quality of discussion that we have had today. All right, and also to everybody that was able to join us, we had over 30 something people that joined. I know that it's very, very tough for people to use their data, particularly in the other climate of Africa where everything is expensive. So, but for us to have this number, we want to say we want to say very big thank you to all those that joined from Canada, from US, from Enugu, from Jalingo, from Lagos State, and from everywhere you joined. Thank you so much. And like Dr. Nubi said, this is recorded, and we are going to do our best to make sure that it's shared across all platforms so that people can join and get from the wealth of experience of Dr. Nubi and from all that he has shared today. So once again, without wasting much of our time, I want to thank our guest speaker all the way from Vancouver, Canada. Thank you so much. And also our wonderful sister and nurse from Lagos University Hospital, Nurse Tilaya. Thank you so much. On this note, I want to say thank you and happy World Mental Health Day to everyone. Like you know, this program was brought to you by Sun Alliance Foundation. We had a World Health Day just some few weeks ago. We're going to keep educating the populace through this platform so that many can learn. That's all for me. And once again, thank you, thank you, thank you. Back to Nostiti as we close.
Thank you.
Thank you, sir.
All right. Thank you very much, CEO, founder, Sand Alliance Foundation. Thank you, Dr. Ogunnubi has to go. Thank you, everybody that joined from all over the states in Nigeria and abroad, Canada, UK, USA. We say a very good thank you to you, and we hope that you pop all your questions. This particular question that I saw, if Doctor this thing is not in a hurry, somebody said that medical training is attached to bullying, harassment, and all of that. I couldn't mention for if it's a nurse that said that, I could have answered. But he trained and he enjoyed all the bullying and the harassment in Lagos University Teaching Hospital up to his South State. Possibly he could help you with that answer. Dr. Okeri, did you want to answer that?
Okay, so I think Dr. Ogunnubi has also answered the question during his speech. Yeah, there are some of the problems that you have. Some professions are much more prone to that. And it's interesting that some of the trainers also may have some mental health situations that they did not attend to. We must acknowledge that the work itself could be very, very stressful, particularly for those of us that are in the medical field. So, like Dr. Nubi said, we need, as individual, we need to take care of, and as health professionals, we also need to take care of our mental health. Now, if you don't take care of those mental health, you're going to pass that aggression, right? You're going to pass it to your junior colleague. Sometimes you even pass it to your patient. Okay, so both the patient and we healthcare professionals need to take care of ourselves so that we can also have a positive work environment, not just for ourselves, also for our colleagues, and then by extension, extend to our client or our patient. So I have experienced burnout before. We need to also make sure that our workload is planned, not that one doctor we have to say um thousands or hundreds of patients. That can lead to burnout. And once burnout setting, that can also lead to an adverse work environment. So I would say is a circle. Take care of yourself, take care of the work environment, and then we have a better place for everybody. I don't know if that answers your question basically.
All right. Okay, if we say we should keep talking, we are going to, like you said, we are going to take it up because this is my place, this is my meet, and this is what I'm really passionate about. I'm just going to keep speaking. So we leave it at that. Please do well to keep your questions. We promise that we're going to answer them as much as possible. And I saw a post from Dr. Bruno, who is a consultant in NSU neurosurgical unit. I'm sure he joined from very fast state. I really appreciate it. Shout out to you. And a shout out to my boss, DDNS Lawal, who took time, my big chief, who took time to be here with me. I'm very happy. Every other nurses, Moyedoku, Mary Rose, and everyone. My big boss, Oluwakemi Omoyeni, Head Nurse Youth Initiative. I say a big thank you to you. Thank you all for joining us for this program. And we say that mental health is the king of health. Please take charge of your mental health, even at the workplace. And God bless us. Thank you very much.
All right. There is no health without mental health, and happy World Mental Health Day to everybody all around the world. Please feel free to follow us on Instagram, Sunderland's Foundation on Instagram, and also you can, for those who have questions, you can follow us and send your questions, and then I'm sure Dr. Nubi will be able to answer your question. You can also follow us on Facebook. These things will be posted and on YouTube so that you can watch it. Thank you so much for once again for your time. Yeah, I have a friend from Enugu, Grace. Thank you very much for joining. And then we really appreciate you. Also a public health physician. God bless you all. It's been a nice day. Thanks, not Titi, and to all SAF and management team. We appreciate you. Goodbye,
Happy
everyone.
World Mental Health Day.
Yes.
Bye.
Bye.